Great. So in this video, we're going to be talking about suctioning, and specifically, we're going to go over just some general principles and then some special cases we'll show towards the end. And this video actually kind of dovetails into the other video we have on suctioning that goes over the 4 different quadrants and positions to be in when you're doing those kinds of cases. So let's go ahead and just begin with a few slides and then we'll get into the video. First of all, we want to make sure that we don't let the water puddle in the back of the mouth. Patients can gag and choke when there gets to be too much water back there. And also air from the handpiece will start to blow the water around. So obviously when you're in there suctioning, you're trying to make sure that you don't have a lot of water accumulation down there. Also make sure that these tips, these high-speed evacuator tips right here, they're very not sharp, but they're kind of rigid. And you don't want to press that into the gum tissue. So be careful with the tips of those. And then when you do find where you should be suctioning, stay in that spot. You don't want to jump from one side of the mouth, from left to the right, up and down all over. Just find a spot and kind of camp out there while you're doing your suctioning. When you start moving around, there's a greater chance you're either going to bump the drill or get in the sight of the doctor trying to, do what they're doing. So just when you find a spot, just keep it there. It's also for patient comfort that you would want to just stay kind of in one spot. When the doc removes the handpiece, you just need to go in real quickly with either with this evacuator or with the slide ejector and just kind of quickly clean that area out. And I'd say once the water has been kind of suctioned out, go ahead and take the suction out. There's no reason to keep the suction tip in there. Once it's done its job, take it out of the mouth, because when you just leave it in there, it's causing maybe discomfort for the patient, but it's also just kind of holding up the procedure as well. And then with the suction, either have it 100% on, the little switch that turns it on, or keep it 100% off. Don't kind of go midway in between. Just it's either all on or it's all off. And then when you're suctioning, you're not just removing water and saliva and blood from the field. You're also going to be retracting. And so you can be using the actual suction tip to do the retracting. You can use a mirror. You can use an air water tip. And what you're retracting obviously is going to be the cheek, the tongue, the lip, just making sure that it's protecting the patient, first of all, most importantly. And then second, of course, just to allow access for the doctor to get into the area they're trying to work on. There's one thing that we want to let patients close on the saliva ejector, but we don't want to do it too frequently. It can really interfere with the flow of the procedure. In some patients, they're just a quick little, suction and then they're done. Others sit there and they just keep suctioning and suctioning. And when you're trying to get a procedure done, if they keep doing that over and over, it can really interfere with the flow of the whole procedure. Also, when you're suctioning, the other part of what you're supposed to be doing, especially if the doctor is working on a top tooth, is to keep the mirror blowing off. So you have the air water tip in one hand, you got the suction in the other, and you're trying to stay out of the way, suction up everything, and blow air on the mirror. So it's like windshield wipers on a car driving in the rain. You want to make sure that mirror is staying clean so the doctor can keep looking where he or she needs to go. And then also when you're going to go with your air stream, keep it steady. There's no need to go in there and wave the air water tip around. Just when you find your spot, just kind of stay still. Just like you're keeping the suction still, keep the air water tip still as well. And then another thing with suctioning is sometimes you replace topical gel before you give an injection. And when you go take that topical gel out, it's good to go straight in with the suction. What you don't want to do is take out the topical gel, turn, throw in the trash, allowing the patient a chance to reset themselves. Sometimes they'll go like that, and all of a sudden that topical gel is all over the inside and starts going down their throat, and they start thinking that their throat's going to be numb. It's just best if you can take out the topical gel, whatever it is, the Q-tip, the gauze, the cotton roll, take it out and go right in with the slide ejector so you can start getting 95% of whatever gel that still might be remaining in the mouth out of there before the patient swallows it. And let's see here, suctioning up etch, and we would call it, there's a product called Cutrol. There might be astringent. These different things that we might be applying during the course of the procedure. You're going to see that coming up actually shortly here in this video. We want to make sure when you're suctioning it up, it goes straight into the right into the suction. It doesn't splash and go all over the mouth or go onto the patient's tongue where they're going to taste it, because none of these things taste good. When we're cutting off of a crown, we want to make sure we're in there with this high-speed evacuator. so that you can catch if there be a piece of porcelain that may pop off, or maybe the crown itself may pop off. You're ready to catch it with the saliva ejector before it goes down the patient's throat. And you want to, when we're going into place of filling, we have to make sure the field is dry. So usually wash and dry. We go and place the dry angles, some cotton rolls, but right before we put the cotton in, sometimes we go with the saliva ejector and just real quickly kind of get the excess puddle that's in there, and then we'll put in the cotton roll. And then lastly here, when we do extractions at the very end in our office, we go in with different irrigating solutions with a monojet syringe. And when we go squirt that in there, that's a lot of volume of water or volume of whatever our rinsing agent is, chlorhexidine, that can be kind of overpowering for your surgical suction. So just have your saliva ejector and your HVE ready to go so the patient doesn't fill up with those liquids too quickly. Okay, so here's an example of taking the etch, and we're going straight from the tooth and catching it with the saliva or with the HVE. And that's kind of straightforward. We just don't want it splashing around, again, splattering across tissues. Again, that was a top tooth. Here's a bottom tooth. You can see the same thing. Maybe I'll put my finger in there just to kind of block it from going down the patient's throat. Pretty straightforward stuff. I think here's another one on the top left. Again, I might be coming in from the palate with the air water, and the assistant's going to be sitting there right there in the distal, ready to catch the majority of that blue etch when it comes right off, again, so the patient doesn't taste it. This product right here is called Cutrol. Some people might use astringent in it. It's a styptic agent. This stuff tastes really bad, and we'll make sure we get that suctioned right away. You don't want to take it out while the doctor's reaching for the air water. Just keep it in there to catch any little drop that may start to slide back. Okay, right here, this is just showing the patient going in. That's a real quick little reset for that individual. They hardly even did it at all. And here's a patient who's going to now suction on this thing for what I consider to be quite a while. It may even seem like a couple of seconds, but sometimes when they sit there, they'll milk it for quite a while. This part of the video is actually showing me putting in a filling. Let me back up just a little bit. And I'm kind of placing it, and the water and the saliva is just starting to build up a little bit in the back. And so the assistant's just going to slide in with the saliva ejector just like that to kind of quickly get that fluid, get that liquid out of there so that it doesn't start to interfere with the actual placement. Now here's going to be the removal of a crown. Now when we do a crown removal, we take a burr, we make a slice from the buccal across the occlusal down to the lingual. So now we got two halves to this crown. And then we go with this instrument. It kind of looks almost like a screwdriver. And we're going to go in there and we're going to wedge it and pop the crown off. And so if you notice, the assistant is ready with this high-speed evacuator, ready to catch any pieces that might come flying off. And so here we'll see I'm just kind of wedging that back and forth, waiting for the crown's cement to release. And there it goes. There's the distal half. I don't know if you saw that. It was a little piece of porcelain that actually came off there. Let's see if we can catch it right here. Right about there. You can see that little shaving right there. The assistant's going to catch it before it goes down the patient's throat. And then I just reach in and grab it with my fingers. Here's another one. Here's a PFM crown. And we're going in. We made the slice. And we're going to try to remove one of those halves. And as we're kind of working it back and forth, it really wasn't loosening up. So then I got a hemostat. And imagine this. Imagine trying to hold a wet marble with pliers. That's what it's like with a hemostat trying to take off a crown. And so again, being ready with the suction in case something were to pop off, you're ready to hop right in and catch it, which is what happened here. We're removing it, and I had it in my hands. At least I thought I did. Oh, wait, that piece came off just fine. Sorry, it was the next piece. Trying to take it off, it didn't budge. And so I actually had to took that half and cut it in half. So I got this quarter piece getting ready to come off. If you'll notice, we're back there trying to get it off the tooth, and she's going to have to go right in with the suction and grab it. So watch that piece. Trying to reach for it. There it fell. Now I went right in with the hemostats, but she was ready to go right away with the suction right away. So again, a piece could come loose, gets knocked down there, ready to grab it. Here comes the next piece. That piece didn't want to come off, so I had to thin it. And during the process of thinning it, you're going to see it come flying off. And she's ready to catch it, ready to go right down there and just grabbed it before the patient had a chance to move their tongue around and swallow it. And that is it. So I hope you enjoyed the video, and hopefully this improved your suctioning technique. All right, take care.